Welcome to our May State Technical Assistance webinar. We're going to get started in a few minutes. Welcome to our May State Technical Assistance webinar. Thank you for joining us today. If you can, we would love to see where you're from. So if you could enter in the chat your state and jurisdiction, your title, and your area of focus. We would love to welcome you, and we'll be getting started in a few minutes, just at the top of the hour. You can also unmute yourself and say hello. I see a few familiar names and some new names. So welcome to everyone. Thank you for joining us today. We do have a question at the bottom of our screen. You should see the chat that's open. If you could please list your name, your state jurisdiction, your title, and your area of focus here. We would love to say hello. You can also unmute yourselves if you've muted yourself, and say hello. We would love to hear your voices. Hi, Teeny. Thanks for joining us today.
Glad to be here.
Thanks for introducing yourself, Jenny.
Looking forward to a robust interaction.
We're really excited today. We have a full house of CSN staff with us, and we'll be presenting on quality improvement. So in the meantime, as we're waiting to get started at the top of the hour, you can say hello in the chat, or you can unmute yourselves and say hello. If you enter anything in the chat, we would hope that you enter your state or jurisdiction, your title, and your area of focus, so that we can see who's in the room and see who's joining us today. Hi, did somebody say hello?
Hi, this is Megan Selheim in Wyoming.
Hi, Megan. Thanks so much for joining us.
Yeah.
Hi, Dina. I see Dina introduced herself in the chat as well.
Hello, it's nice to see you.
Nice to see you as well, Dina. I'm seeing some familiar names, some new names, and we welcome you all. Hi, Tina. Thanks for joining us today. So we will get started. It is the top of the hour, and we do have a packed agenda for today. So you can continue saying hello in the chat as we move to our main layout. Hi, Brittany. Welcome. Wonderful. Well, thank you all for joining us today. Today is our 12th State Technical Assistance webinar, and we are really excited to have our CSN colleagues with us today. So the Children's Safety Network is a project supported by HRSA, and we are HRSA's primary vehicle for child and adolescent injury and violence prevention technical assistance. So say some technical tips here. Please make sure that you mute yourselves, and you can always unmute yourselves during the Q&A. You'll have to press *# at that point. We do have some file shares, a file share pod at the top with some documents up there, and some web links that we would love for you to check and to check out. We are recording this, and this will be on our website shortly. So we are going to, as Jenny mentioned, we're going to globally mute all of the lines for the presentation to preserve the audio quality, but you are able to unmute yourself at any time by pressing *#. And please do so, because we do want to hear from you, and this is a very interactive presentation today. So just quickly, I'd like to introduce our agenda. We'll be talking about how to advance child safety through quality improvement. We'll go through some state examples, and then we're going to have a full learning lab. Our learning objectives for today are to explore how quality improvement could increase the value of your work, to gain an understanding of select tested quality improvement tools such as systems mapping, SMART aim statements, plan, do, study, act cycles, and to brainstorm some areas for improvement. Our presenters for today are Jennifer Leonardo, who is the Director of the Children's Safety Network. Jennifer has extensive experience in public health and social work program development and evaluation, capacity building, and facilitation in domestic and international settings. She served as a quality improvement advisor, facilitator, and manager on local, national, and international public health initiatives spanning child safety, academic and social emotional success, health system strengthening, and management and leadership development. She has the subject matter expertise in injury and violence prevention, intimate partner violence prevention and treatment, suicide and self-harm prevention, and diversity and cross-cultural issues. In her leadership of the Children's Safety Network, Jennifer builds the capacity of states and jurisdictions to use data and evidence-based strategies to reduce injury-related deaths, hospitalizations, and emergency room visits. She has guided 21 states and jurisdictions in improving child safety through rapid cycle tests of change and supported state public health workers in spreading evidence-based practices. Next, I will be presenting, and I'm a Senior Training and Technical Assistance Associate for the Children's Safety Network and co-manager of the Child Safety Learning Collaborative. I lead the suicide and self-harm prevention team, and I'm also the data manager for the collaborative. I'm also one of the co-leads of our health equity work and use my background in education and research to help state health departments improve their programming and outcomes. And then we'll have Jenny Stern-Carusone, who is the Associate Director of the Children's Safety Network. And she has over 20 years experience specializing in youth development, quality improvement, and injury prevention across diverse populations. Her expertise includes mentoring, delinquency prevention, motor vehicle traffic safety, and community-based program design. As Associate Director at the Children's Safety Network, Jenny builds the capacity of states and jurisdictions to use data and evidence-based strategies to reduce injury-related deaths, hospitalizations, and emergency room visits. In the Child Safety Learning Collaborative, she leads the motor vehicle traffic safety team, implementing quality improvement approaches to improve child safety through rapid cycle tests of change and spreading evidence-based practices. Jenny also provides consultation on webinar design and development and serves as the Chief Technical Producer for the Regional Education Laboratories. So welcome and thank you to all for joining us today. So without further ado, I'll pass this over to Jennifer to get started. Thank you.
Thank you, Maria. I'm so excited to be here today. I can see the list of guests, and I know that some of you are experts on some of these topics, so I'll be drawing on your expertise when we get to the experiential part of our time together. I just want to do a quick show of hands here. And Jenny, I need a little tech support because I'm not seeing my notes, my questions here come up.
No problem. I will open up your notes for you. Again, the hand raise function for others is located at the very top of your screen. There's a little hand. So you can use that to respond to Jennifer's questions.
Thank you, Jenny. I would love for all of you to take a moment and raise your hand if you've ever worked on a quality improvement initiative. Okay, I see some hands going up here. Jeannie, Abby, Tina. Great. Okay, so some of you have not, and this is new to you, but it's looking like about a third of you in the room have had some experience. I'm going to ask about some specific quality improvement tools. Kate, if we could clear the hand raising, please. And we're going to ask the question, are you familiar with systems maps? If you could go ahead and raise your hand if you've ever had experience with a systems map. Okay, I see some experience in Pennsylvania with Elizabeth. wait a few moments. I know there are some others who have seen systems maps in their work. Okay, maybe we have a little bit more to talk about here. I do see some folks have not raised their hands. If we could clear that out, please. Thank you. How many are familiar with SMART aim statements, the acronym SMART? Some hands are going up. Oh, a lot more hands are going up now. Fantastic. About 11 or 12 people raising their hand. Thank you. We'll review that today as well. And then if we can clear that out, wonderful. How many have experience with plan, do, study, act cycles? Some hands are going up. There's some overlap with folks who are familiar with SMART aim statements, who are also familiar with plan, do, study, act cycles, but not everybody in the room. Okay. Wonderful. Thank you for that. We'll get to go over all of that together today. I'm going to start with the definition of quality improvement. Different organizations will put out different definitions. It is a systematic approach. You're going to use continuous actions that will lead to measurable improvement, measurable being a key word here, in healthcare services and the health status of your targeted population. And this definition is from the U.S. Department of Health and Human Services. So really, if you've identified any area for improvement, there are some tested approaches and tools that you can use to be able to achieve your improvement goals. I'd like to start off with this slide because folks are typically familiar with traditional research, especially in healthcare practice. We're very used to seeing peer-reviewed journal articles. We know that their purpose is to discover new knowledge. We often look at the rigor of the methodology, and we look for large, rigorous tests, randomized controlled trials. We really are looking to control for as many biases as possible, gather as much data as we can, and it often can take a long period of time to go ahead and set up a study, to run the study, and then to get that published. Quality improvement is distinct in that it's really about the process improvement piece, and it is about bringing some existing and new knowledge into your daily practice. And that daily practice piece means that you're not only looking at what is that evidence, but how are you getting your team members to adopt that evidence and put it into practice in a sustainable way. The approach is that you're going to be using a series of sequential, observable, rapid tests. Rapid here is so that you look at failure as an opportunity, so failure in quotation marks. You're doing small tests with small numbers of people in limited geographic regions so that your team can gain confidence about what is working well and what is not working well. And if something isn't working well, you learn from it. You may decide not to do it. You may decide to adapt and try something new. You try to stabilize your bias because you're in practice. You're in a real-world setting. So you can't have this large randomized controlled trial oftentimes. But you can say, if I'm going to work on a child safety topic such as falls prevention, maybe I'll work on that first with a school in a rural area. Let me see if that works well. Well, it worked well. Let me now go and see if it works well in an urban area. And so you're starting to look at extremes along different variables within your population group to start to limit some of those biases. And you're collecting just enough data to answer your quality improvement questions. So the focus is on these small tests of change, which we'll get an experience at the end of this webinar, and we'll do it together, so it'll make more sense then for those who aren't familiar with it. Back in the definition, it started out saying that quality improvement is a systematic approach. So it's really about understanding your current work system and the processes that you use every day within your teams and across your stakeholder groups. It's coming together to have consensus about what kind of improvement do we want to make together. Where are we today? Do we have data? Do we have measures in place to let us know if we're achieving what we're trying to achieve? And you really want to start to have your team come up to speed on what those methods and tools are and start to apply those So we'll often ask people to report out in weekly meetings or monthly meetings about what they're learning. We always want to use evidence-based strategies or practice-informed strategies, and we want to measure our progress. The other piece is that there is a defined time frame. So it's not forever. When you set up, and we'll see this in just a bit, when you set up your aim statement about where you want to go, you'll put a time frame on that. And that's really helpful for folks in terms of how you allocate your resources on a team and in motivating people to work toward that deadline. At CSN, we use a framework for quality improvement and innovation that we tested across 20 states. And what we found, primarily in working with departments of public health, is that we want to be able to have technical assistance provided along child safety expertise. So culling the literature, looking at the evidence-based practices, looking at the strength of the evidence in your areas, whether it is suicide and self-harm prevention, poisoning prevention, or motor vehicle traffic safety, for example. We then want to make sure that you have very strong leadership and management practices in place. Depending on your organization and your system, you may need to have senior level leadership on board. You certainly will have to have management structures in place and somebody driving the process because it is systematic and you want people to stay on that time frame. And then, of course, you want your systems improvement methods and tools that are understood by all team members and used on a regular basis. What we see is that when you have these three components in place, your workforce gets developed, your capacity improves, your knowledge of quality improvement improves, and also your ability to go and put it into practice. We've then seen that you get improvements in your injury and violence prevention systems. And some measures that we have here would be the number of teens receiving driver safety education, or the number of schools that are using an evidence-based suicide prevention program. And the theory is that when you have the workforce development and those improvements in your system, that ultimately you're going to have your health impact. And at the Children's Safety Network, we define health impact as reductions in fatalities, hospitalizations, and emergency department visits that are related to child safety. So we had a webinar back in March that focused on systems thinking, and that webinar archive is available to you. You can go and listen to the recording, or you could download the slides. There's a lot of information in there. So I'm not going to take a lot of time today to go through the nuts and bolts of systems thinking, but especially for those who haven't seen a systems map or who need a quick review, I'm going to spend a little bit of time on it now. And Jenny just put a link over in the chat for you on the systems thinking. So first we start out with what is a system? And this is an important question because what we find in working with teams is that sometimes they start to say, well, is it my whole organization? Is it a division in my organization? Well, what about the coalition I belong to? Or is it just the one program or a particular project that I'm on? And what's important is to empower yourselves and empower your teams that you make that decision. You define your system. You have to put the boundary in your system and have a common understanding among your teams to how you're defining that system so that then you can get to saying, okay, what is our system trying to do and how can we make improvement? The different parts within a system are all the work processes, all of the relationships that are taking place, the people who are involved, your beneficiaries or key stakeholders, and all the people who provide your inputs. And depending on where you are in your system, you may not see the whole picture. So something that is helpful for teams is to sit down and to go through, let's define the system, let's look at what we're aiming for, where do we want to make improvement, are we doing what we said we would do we have the right people on board? Do we have the right stakeholders involved? Do the stakeholders know what their roles are? Do we know what the role is and what we're asking our stakeholders to do? And how engaged are they? And then you want to identify and you want to discuss the interactions that are happening in your system. And you'll probably find that some things are working extremely well in supporting your overall aim, and some things may not be working as well as you would hope. Then you go and identify all of the different operating rules that may be presenting some barriers to cooperation within your system. So for example, in our current context, maybe there was a barrier presented by COVID-19 and some of your stakeholders being pulled off in different directions and being unavailable to do some of the work that you had laid out. You also want to clarify your target audience and have some measures in place. And then you want to have those process measures outlined, because quality improvement is really about focusing on the process improvement. So we know that health impact could take 5 years, 10 years, but what can you do in a year? And how do you know that you're staying on track? This is the systems map that I asked about back on that first slide. And I find that it's really helpful for teams to be able to draw something out and have something be visual. So we'll go through what a SMART aim is, but the aim is just, what is the goal of your system? What are you trying to achieve? And then you can look and say, okay, what do we do? What are those processes there in the middle? And you could name your key processes. And then you could put down on the left-hand side all of your inputs. Who are those stakeholder organizations or those key individuals? What are all the resources that I need? It could be funding, it could be equipment, it could be technology. Who are the clients and the beneficiaries of my system? In child safety, oftentimes it's not just the child or adolescent, but it would be the caregivers, the parents, perhaps school personnel, perhaps healthcare providers. And then what's your ultimate output? So what are those measures that are going to let you know that you're staying on track and you're making improvements? Some of the advantages, if you start to have this visual of here's how we define our system, is that your team is going to better understand all of the complexity. And you'll be better able to manage that complexity because you'll have a common language, you'll have a common visual of it. You're going to start to be able to anticipate and then prevent and mitigate unintended consequences because you'll be meeting on a regular basis. You'll have your management structure in place. And when you start to do this, it's going to become easier to spot and address the challenges or the gaps and bottlenecks. You may find as you're studying your system that there's a particular time of year where you typically have a bottleneck, and then you could start to anticipate that and plan for it. It also starts to really get you into the mode of thinking of, we have an aim statement we've identified, we may not be achieving it. Why not? Are we using the highest leverage evidence-based strategies that we have access to? And we do provide a lot of technical assistance around this area. So what is in the literature, and then what are states finding as they're testing these different evidence-based strategies? And are they making adaptations for the different groups that they're working with? And once you do all that and you start to gain some confidence that you're making improvements, then you can start to think about how do you scale up those improvements? How do you reach greater numbers of people, or how you extend to different geographic regions? So I'm going to let Maria now talk about the SMART part of the aim statement that you would have for your system.
Thank you so much, Jennifer. So as Jennifer noted, a critical component of establishing and defining your system is to create the common purpose or an aim statement, and we always promote using a SMART aim statement. And a number of you indicated at the beginning that you are familiar with SMART aims, so it'll be a bit of a review for you, but it'll be new for the folks who haven't been using SMART aims. So our first step is to discuss what is SMART. So we have to establish a SMART aim for the improvement initiative. And we use we say SMART because we want to talk about very specific things. So we want the aim to be specific. It should include a clear and well-defined system, location, and a population. So who exactly is going to receive this initiative? It should be measurable, which should include some quantitative goals, like how much of an improvement should you have. The A is for actionable and attainable and ambitious. So it should be within your sphere of influence, but it should actually promote an ambitious change. It should be relevant and realistic. It should align with your organization's priorities and that you have the time and resources. And we know that in the middle of COVID-19, this has been a really big issue of time and resources. And it should be time-based or time-bound. So it should include a time frame by when we should expect the results to be achieved. So let's continue along here. So a SMART aim is a written, measurable statement about the expected outcomes of the system. And Deming, who we've quoted here as our source, is wisely stated that a system must have an aim. Without an aim, there is no system. So that's why it's at the top of our systems improvement map that Jennifer just showed you. The key characteristics of this aim is to provide clarity, consensus, and forward thinking. And so that not only does the system need to have the aim, but the aim needs to be known to everyone in the system. So you all saw the little fish connect the dots that Jennifer showed earlier. And so, you know, if you're in charge of your system or you're trying to identify your system, you know that the ultimate image is the fish. But if the individuals, if your partners or your colleagues are on different points of that connect the dots in the fish, they might not know that their ultimate aim is to create an image of a fish. They might only see who they're connected to, who's closest to them in the work that they're doing. So the aim has to be known to everyone in the system so that every point on your connect the dots actually knows what's happening. And the aim serves as a value judgment, establishing the purpose of the system and informing the steps and actions that you need to achieve this purpose. So there are a number of benefits to having an aim statement. It provides the direction and the platform to convene agreement, vision, and alignment and commitment amongst your stakeholders. And a strong aim serves as a way to communicate your work and purpose to both internal and external groups and to establish what you expect to do, how much change you are seeking, and how disruptive that change might be to the current paradigm. So we want to make sure that we don't use words like some or soon, because we know that some is not a number and soon is not a time. So we'll go through a couple of examples of aim statements, and we'll point out some key characteristics here. So the first example is for the motor vehicle traffic safety topic. So by May 2023, the state will reduce deaths by 2%, hospitalizations by 8%, and emergency department visits by 12%, resulting from a crash in which the victim was a teen driver or passenger between the ages of 15 and 19. So the example shows that we have it's time bound. We have by May 2023. These are measurable. We have percentages that we want to decrease. We have identified who we're working with and what the goal is. So the example below shows what an aim might be at the partner or local level that clarifies what the expected outcomes are sought in a local context. So that will then contribute towards achieving the overarching aim in the system. So we have by May 2023, Malcolm Public Schools will increase seatbelt use amongst high school students, drivers, and passengers from 80% to 90%. So the key important parts here is that we're showing some measurable aim statements here. We're showing that they're also time bound. They have a start and end date. So how do we determine then? We go from our system map. We identify our SMART aim, and then we want to break it down into 90-day aims. So 90-day aims, if you're familiar with this, are bite-sized. I like to call them bite-sized or digestible 90-day aims. We're pulling out, we're looking closely at our overall aim statement and scanning our current environment. And we're considering what would be a feasible goal for our ultimate aim statement within the next 90 days. So what actions do you need to take in order to get to your goal? Are you using evidence-based or evidence-informed strategies? Who will be responsible for these actions? How will you measure your progress? And then plan how you will share and what you've learned with your team and partners. So how will you integrate what you've learned into your next 90-day aim statement? So if we think about the examples that we just showed, we had the examples were by May 2023. So if we wanted to break down all of those pieces, we have about approximately 2 years. So we would break it down into approximately 3-month aim statements. So this makes it much more digestible. Instead of being overwhelmed by the ultimate aim, we can think about, okay, in the immediate future, what can we do that will take us to our ultimate aim, but what's actionable right now? So in order for us to do this, though, we have to think about some data. So we have the role of data is extremely important in our aims. So data is used throughout the improvement initiative. And we may need different types of data depending on where we are in our quality improvement journey. So our stories evolve, our projects evolve. As we get more into our quality improvement initiatives, we may learn something that changes the way that we think about the initiative. So at the launch of the improvement initiative, you would collect baseline data about your system that would inform the SMART aim statement, that you create. So if you're at the beginning of this, you're finding out, what's going on, what's the problem that you're trying to address, and developing your SMART aim. Throughout the improvement initiative, you regularly collect and use data for decision making. You may decide to try a new work practice and test it for a few days, and you would collect available real-time data and decide if you want to adopt, adapt, or abandon that practice. You would also collect real-time data on an ongoing basis that lets you know if you're making progress towards your aim statement. For example, you may want to track how many CPS or child passenger safety, technician trainings are being held, or changes in knowledge or behavior among teens with respect to using seatbelts or distracted driving. And then finally, when you evaluate your improvement initiative, you're looking at the long-term impact. As this is a population-level health data, it may not be available for a few years. And so, for example, at CSN, our long-term outcomes are reductions in child fatalities, hospitalizations, and emergency department visits. And this is something that we evaluate every 2 to 3 years. So why should we collect and report on data? There are many obvious reasons for doing so. In a quality improvement initiative, in addition to being able to exemplify what works, it is also critical to be able to understand why it works. So we need to collect a variety of data and that will be helpful to inform our decisions along the way. You don't need to be an epidemiologist or a researcher to collect and analyze data, and there are a ton of different types of data that can help inform your process and improve your results. So let's look at the different types of data. It really comes down to what do you want to learn. So we have some examples here on the slide that we want to look at the frequency, how frequently are we collecting this data, what are we capturing, are we looking at the plan, do, study, act cycles, which Jenny will be speaking about in a minute. What have you already tested, what have you been working on, and then your measures, what are your data sharing agreements with other departments or your partners, how often do you receive data. You want to think about all of these different questions. So we also know that we need to have quantitative and qualitative data, and both have value, especially in a quality improvement initiative, but it is noteworthy that either type of data may be real-time or cleaned available data. For example, if your aim is to reduce injury or fatalities for child passengers and the desired change is to increase the number of car seats distributed, you'll want to collect quantitative data on the number of injuries and fatalities. And we do know that as state-level data, most of that data is not readily available in real time. So in that case, you could also collect quantitative data on the number of seats, the number of recipients, and so forth. But to understand how you're actually achieving your desired change, you would also want to collect some qualitative data about the process of distribution. How are you outreaching and connecting to potential recipients? What is your distribution procedure, and so on. It's truly this qualitative data that tells you the full story and gives you the greatest insight about the potential areas for improvement to help you achieve your quantitative results. So just as a reminder here, so we've gone through the system aim, We talked a little bit about the digestible parts of the 90-day aims, and then Jenny will be speaking to you about the PDSAs. And it's really important for us to remember that these are not all standalone tools. They're interrelated, and that quality improvement is iterative. As you go down from your system aim to your 90-day aims, you'll want to break down those 90-day aims into smaller tests of change, and then take that learning back to your 90-day aims and back to your system aim. So without further ado, I'll pass it along to Jenny to talk to you about Plan, Do, Study, Act cycles.
Thank you very much, Maria. I want to encourage folks. I've been peppering the chat and having a conversation, I think, with myself over there with a lot of reminders of the resources that we have available at CSN and here in today's event. But a reminder that this is a technical assistance webinar, and we're really looking at serving your needs. So this is not a present out opportunity. We want to hear from you. You may unmute your line at any time using the *#. You can raise your hand and we'll call on you, or just enter your thoughts in the chat. We are going to have an interactive moment here shortly after I present on Plan, Do, Study, Act cycles, but we also are very open and encouraging of your questions and thoughts as we go along. So let's talk a little bit about the Plan, Do, Study, Act cycles. How familiar are you with PDSAs? Do you use them all the time? Have you used them on occasion? You understand them, but you run away from them and don't use them? Or you have no idea what we're talking about? Looks like a couple people have used them occasionally. Right? A couple brave souls that are using them all the time. We're looking forward to hearing from your experiences. It looks overall, with a few people that are responding to the poll, that generally we have, some pretty well-seasoned folks here that have been using and understand PDSA. So that's great. So with that, then I won't belabor you with too much detail here. So as you know, and you've heard today already, quality improvement processes engage key players in a system to focus on specific problems and practices, and then using a series of iterative cycles, identify and test change practices, make predictions, gather data about the change practices, and study the potential influence that those change practices have on the outcomes of interest that you have, such as the number of people that you've trained or number of resources distributed and so forth. So again, we're tackling big problems, big issues, and trying to break it down into manageable components, and being able to manage those components at even a more micro level so that we can identify where we have opportunities for change and adjustment. So those are the Plan, Do, Study, Act cycles. So very briefly, the plan part is where you identify what your objective is, establish a question and your prediction, and determine why you're doing the work and how you're going to do that work. Then you implement that plan with your do portion of the cycle, and you collect data and track what you're doing so that then you can study what you've done and look at the data and the results of your work, and then you act on that by determining what's next. Are you going to adopt, adapt, or abandon these processes or activities or tasks that you've been doing? So again, with the adapt, adopt, and abandon, this is a critical component of the PDSA cycle, because this is where you've taken that larger concept and broken it down into a manageable component, and you can really look at the different levels of detail to determine, should I, for example, if I'm trying to get people to come to my intervention site, how do I let them know about that? I've sent out emails, and I've done a blanket email to all of my population base. I only had about a 50% turnout rate. Maybe an email isn't the best way. Maybe I need to email and text people. So now I tried that in my next PDSA. And then you see, oh, I got a 65% show-up rate, but that's still not enough. So then you keep on tweaking what you're doing, keeping the parts of your process that worked, abandoning those that do not, and adapting the ones that maybe could be tweaked and improved upon. It's really important to decide on the scale of the test. So again, a lot of the work we do in public health can feel really large and unwieldy at times. And the advantage of applying quality improvement in your work is it enables you to do this this breaking down process. Remember that the PDSA is a framework for testing strategies throughout your improvement initiative that encourages trial and learning, enabling you to break down the processes into those smaller, more manageable components, and then drive decisions through the use of data. When you look at this table, it really helps to focus you on what you're trying to get towards, where you're looking to get towards the highest degree of belief that a change ideal will lead to improvement with the lowest cost of failure, so that you're not throwing all of your time, money, resources, etc. into something only to find out that it didn't get you where you want to go. So you start with small-scale tests that are going to be the lowest cost of failure that you have available to you, and continue to build upon that until you get to a higher degree of belief that what you're doing is actually going to get you to the improvement that you're seeking. I'm going to just quickly go through a couple of examples from some of the work that we've seen our states do. So for some of you, this may look familiar. Here in this PDSA example, we're drawing on teen driver safety, and this PDSA is focusing on establishing what a baseline is that the team can use to then design their ongoing strategy. So as Maria indicated, this is where we're really at the launch of our initiative. The team was looking to improve adherence to and enforcement of the graduated driver licensing rules. So they posed a question as to how many counties in their state were already addressing teen driver safety as part of their state or their county priorities. And then they created a plan to assess the landscape within the state and whether or not there was enough political will to ensure that teen driver safety was actually being effectively addressed. In their due, they conducted an assessment and looked at 120 county health department policies and fatality data to determine if teen driver safety was a priority and how it was being addressed. Then when they looked at the data, they saw, okay, yes, there are 120 counties that do have teen driver safety as part of the work that they're doing in their community, but it's all being done very differently at different levels of effectiveness, not using the same evidence-based intervention. And so they then determined in their act that it warranted developing a technical package that they could use statewide to help inform and improve the effectiveness of teen driver safety work across the state. In this other example, in suicide and self-harm prevention, we see here that a team was looking to determine how their Department of Mental Health and regional support centers would be able to partner effectively with schools and implement the evidence-based program Signs of Suicide. In their plan, they identified some schools that had shown interest in using the program and predicted that a significant number of them would actually want to and implement the evidence-based program. They then purchased and provided that program and toolkits for distribution and tracked the implementation rates. They saw that 100% of their contacted schools accepted and implemented the toolkit, and when they studied that, it indicated that there was enough interest that then that maybe warranted, with new legislation coming out that was going to further enforce suicide prevention and some of these steps towards preventing suicide, that it was worthy of them acting on increasing their funding and efforts in providing this evidence-based program to more schools and to more organizations across the state. Again, that was a great example of where, instead of just putting in a ton of time and energy into something, even though it is evidence-based, to test it out with a group to know whether or not it was going to be worth your time before then spreading it statewide. Here again, we see something similar, and this is even a more micro test, where in this example, the state was working on developing an informational card on graduated driver licensing. And so they wanted to be able to spread this out across all of their, the state and the work that they were doing with teen driver safety. But they first wanted to make sure that the information they were putting on the card actually made sense to the population they were dealing with. So in this instance, it felt fairly monumental to try and get it out to all parents that were engaged, that had teens engaged in the teen driver safety. So instead, they just chose to work with a small handful of parents, 5. And I use this example because it's important to remember that in your work, when you're working on the state level, it's okay to even have something as small as 5. So they shared the information card initially with a group of 5 parents, and their prediction was that 4 out of 5 parents would find that the card was helpful. They used the feedback from parents in their study to then help to adjust the card, and then they ran further iterative tests of this with more parent groups, with law enforcement, and with driver education instructors over a period of time, continuing to improve on the card, and then over the next couple of years, as they continue to implement their system of change, they've continued to go back and again run small tests of change to further improve this excellent resource. I'm going to pause now before we turn to our interactive learning lab. I see that there's been some more activity in the chat. Megan, I see you had a question, and again, people can unmute themselves using *# on their phone pad. So I'll read your question out loud, but if you could further elaborate on it. If you want to work on a PDSA test for activities that are already in practice on a medium to large scale, should we pull a piece out to review on a small scale? Can you give us a little bit more information about what your scenario is? Should be able to press *# to unmute your line. Is that working? Megan is typing. We're going to go ahead and do a unmute all lines. So if people would just mute locally, we want to make sure that you're able to engage. So Kate, let's go ahead and just unmute the lines because this is intended to be engaging.
Your microphone has been turned
Megan,
on.
let's see if that works for you.
He said he could just let me take ibuprofen and Tylenol, or he could just
All right, so remember that we've unmuted lines, so if you're not locally muted, we would ask that you do that. Otherwise, we'll have to mute you on our end. And Megan, are you able to unmute and hear us now?
I can hear you. Can you hear me?
Yes, I can.
Okay, sorry, I was trying it and it kept giving me like a little error message. Yeah, so the context is that one of our priority areas on our Title V grant is to address adolescent suicide prevention, and we are looking at supporting sources of strength in school implementation. But there is already a fairly widespread sources of strength implementation in our state, like probably 10 to 12 schools have it in place and have had it in place for different lengths of time and are probably implementing it with different levels of fidelity. And so the question was around, like, how do we do a PDSA cycle on sources of strength given that it's already widely in place in a variety of stages and types of implementation? So how can we take a little piece of this bigger project to kind of check and see how it's going and what we might be able, how we might be able to support it better and increase the effectiveness of it?
Absolutely. That is an excellent question. I saw that Jennifer gave some guidance in the chat. I think this is a wonderful lead-in to the work that we want to do in the Learning Lab interactivity. So Jennifer, I'm going to hand this over to you to elaborate on what you've already put in the chat and maybe help lead us into how we can build off of this for our interactivity.
Hi, thank you, Jenny. Thank you, Megan. So if we went through some of the questions I put in there, and it's helpful to know what you're working on, the first one is saying you want to start with a question always. So what do you want to learn about these activities? And I heard you say a few things you may want to be learning about. Are these schools adhering to how sources of strength should be rolling out? What is the fidelity? What is the level? So that may be a question. You may be concerned that some schools have high fidelity and some don't. You may be concerned, I'm being hypothetical here, about if it is effective with the students who are receiving this training, if it's effective with staff. So I would ask, do you have evaluations in place? Do you have some data? Are you concerned with what's currently happening? If you start to see that there's an area you want to work on, then you can pull that piece out and start to test it. If you feel that everything is working wonderfully and people are at a high enough level of fidelity and it seems to be running smoothly, then you could ask questions around what's the support that's in place for sources of strength and what would be the threats to it continuing to be sustainable. So is there adequate funding? Is it part of the school's strategic plan? Is it written into their yearly budget? Questions like that. And then if you find that it's not sustainable along those terms, you know, is it someone's particular job description? Is it written in? Then you can start to pull out and test if we do start to work with the local sites on some of these different pieces and we follow them, are they going to be more likely to sustain sources of strength over other schools that are not doing that? Do you have questions or thoughts on that, Megan?
That's all really helpful.
Yeah, I think kind of the trick with the QI stuff is really to keep going back to what's my question? What am I trying to learn? And that's when you get down to the PDSA, and we'll do that together now. That's really where it needs to start, because people then start to say, well, it seems like it's kind of a planning tool and it's just very task-oriented. And that's fine. There's value in using PDSAs as a management tool, but the QI lens would be, what are we trying to learn?
Yeah, and I think
and then if you identify,
we're also still trying to sort out like what our specific role is in this effort, because we're not the only ones who are funding or supporting sources of strength in Wyoming. And so one of the other units at our Department of Health that's also involved in suicide prevention is working on a fidelity study for all of the places that are currently implementing right now. So that's the other thing, is like, in the context of what we might try to pull out and look at, it's partly trying to sort out like what is our role in this collaborative effort, so that we're not duplicating efforts or working at cross purposes.
That's fantastic, and that's where something like a systems map might be helpful, because it may be, you mentioned the word collaborative, so it could be, and I'd say keep it simple. Some of this stuff people get overwhelmed because they see all these maps and all this different level of detail. But you could take that map and you can say, okay, we have these, I don't know, 5 or 6 key stakeholder groups. We're all working on reducing suicide among this population, this age group, this geographic region. What are each of us doing respectively? And then you could, if you have meetings, you know, you could ask that. What do each of us uniquely bring to this, so that we can identify if there is overlap? Is there a better use of time and resources? I know one state that I worked with, they had a suicide prevention program, and they were working across the Department of Public Health and the Department of Mental Health. And once they got together on the same team and they asked that question, they actually started to say, okay, let's not overlap. And the Department of Public Health wound up providing funding for the Department of Mental Health to purchase kits, because they were already doing that work. So they wound up changing their roles a bit once they learned more about their respective responsibilities.
Yeah, thank you.
Sure, it's exciting. I hope you let us know how it goes. I'd be really interested to hear. Sounds like you're doing some wonderful work. Okay, I think we are ready for the learning lab. And the first step is always the hardest, just to do it. I worked in quality improvement internationally, and it always came up that there were just so many challenges. Well, there's corruption. There aren't enough resources. We don't have computers. The generator isn't working. But we would say, but what is the one small step you can take? We know that if you're trying to change the whole world in 1 year, you could easily become unmotivated. It could be very demoralizing to your team. But what is the one step that you can take? And that's the spirit of quality improvement. Okay, so I want this to be an experiential exercise, and this is what we used to do when I worked in the international context, is we'd always start out with something, and we do it individual by individual. We're going to do it as a group. So I'm going to feed you an aim statement, and this one is really arising from the COVID context, where people haven't, in general, been feeling as healthy, emotionally, socially, physically, perhaps, as they used to pre-COVID. So this general aim statement: by May of 2022, I will be healthier emotionally, socially, and physically. So in looking at this, do you think that this is a SMART aim statement? And I just put up there that visual to remind us all of what SMART is. Is this specific? Is it measurable? Is it attainable? Is it relevant? Is it time-bound? And you can feel free to unmute yourself or chat in there. And I see Rachel, thank you. Rachel says, not quite, but a good aim. Tina's saying, no, I don't think so. Elizabeth's saying it is time-bound. Great. And Tina chimes in, it's not measurable. Thank you, Tina. We were waiting for that one. It's not specific enough. A few more folks typing in there. Missing your measures. Yes. How much? In what way? What do you mean by these broad constructs? May not be attainable. There's a lot going on there to accomplish in a year. Great one, Jeannie. And Karen, I'd even define what healthier means. Right. What is healthier? Where am I today? Where do I want to go? What do all these terms mean? Emotional, social, physical for me? It's relevant. I like that one, Tina. Okay, great. So the one we really picked up on here, which I'm glad you jumped out and noted it right away, is it's not measurable. And a lot of these terms are too broad. So this could just be the kind of aim statement where people go out different directions and do a bunch of different things. And they all say, well, I'm working toward that, but there isn't something that's unifying enough. So let's think back to Maria saying, okay, let's think about the next 3 months. Let's do a 90-day aim statement instead. And let's just pick out one piece of this overall larger aim statement to work on and to start to define better and to get some measures around. So what we want to do with you now is to talk about socially. We thought we'd work on that one. So what are we trying to achieve in the next 90 days? And I want you to go ahead and chat in some ideas. What we're going to do is we're going to go through these questions. And then once we come up with a 90-day aim, we're going to work on a PDSA together. So if we're looking at socially, what do we want to achieve in the next 90 days? Maybe people can unmute themselves or type in the chat. How would you define socially? Oh, great. Elizabeth, increased interactions with those outside the home. And Rachel is saying connect with a friend once a week for the next 90 days. Great. So Rachel, you took it even further and you got that measure in place once a week. And Karen is saying within the next 90 days, I will become more socially interactive. Great. You put the how in by contacting at least 6 people and discussing something with them for at least a half an hour. Karen, you're good. You're not letting yourself off the hook with a quick 20-second text in the morning while you have your coffee alone. That's really great. And then Elizabeth, or maybe in the home if you've gone full hermit. Wonderful. Jeannie, I will plan 2 dinner dates with my girlfriends. Nice. And Jeannie, you're kind of on the same path as me. Like, I don't even know if I can do 2 in 90 days. If I did 1, that would be good for me. So that's really great. It looks like you're being realistic here. You know, if you said every night I'm going to have dinner with my girlfriends, I may say, wow, you know, I want to know about your life. Rachel, walk with a colleague. Great. Walk with a colleague during lunch once a week, measurable for the next 3 months. So we've identified some different ways of being healthier socially. Walking, socializing over dinner, interacting. So we would define interactions there. Connecting with a friend. So you may say, how would you connect? Would it be via a phone call? Would it be in person? Would it be via Zoom? So the more specific you can get, the more likely you are to do something. I'll give you an example here in my house. I have 4 kids, 3 teenage boys, and I am dying with trying to feed these kids because during COVID, they were home for lunch and dinner. And so it became really specific in my house, and my PDSA is coming down to what is the meal plan with a specific meal for the week. So what's Monday lunch? What's Tuesday lunch? Yeah, and Teddy's giving us a reminder. Let's get off the chat and start talking because it's probably boring hearing my voice for this long. So we put in what we want to achieve in 90 days. We put in some things we're going to test. Let's get some folks off the line. Is it evidence-based or evidence-informed? Some of these thoughts. What do you think?
Hey, this is Karen. Can you hear me?
I can hear you, yes.
So I was just thinking, if I were putting this in a grant, I would open with the evidence that indicates that being more socially connected, relates to increased better health, et cetera. So I would put in the data on that.
Excellent, Karen. And you may even go further and try to look at what does socially connected mean? Is it better to be in person? Is it better to just be on the phone? Does it matter? And you may tease that out a little bit.
Right, and I haven't read the evidence. Hopefully it's robust and has that in there. But I do know from talking to my mental health compadres that, that is absolutely true. And it's in stages, like many of you said, perhaps as we try to come out of COVID, that you can't do dinner right away, but maybe you could go for coffee or just the walk. And that's, as far as you can go right now, and then increase it.
Right, and maybe it's outside, right, staying with what is realistic during this particular 90 days. And maybe that will change when we get to a 90-day aim statement in the spring of 2022. So that's another real valuable part of doing the 90-day is that your context is always changing. Fantastic. And I love the conversation about evidence-based or evidence-informed. So when we do quality improvement projects, you have your aim statement, you have your key topic, and then different organizations will use different terms. They'll say, we're going to ask faculty, we're going to do literature reviews, we're going to ask experts, right? What they're doing is they're saying, what's in the literature that has the best evidence available, and let's identify that strategy. But then there's also room in a quality improvement project for innovation. And that is when you say, okay, do we want to try a little bit of something new? And so you try that on a small scale where the risk of failure is small. So in hearing you, Karen, I was thinking about my teenage sons and just reading a little bit, not I don't know the literature, but there is, chat around, well, maybe teenage boys, their way of socially interacting in the 21st century is by playing video games together. So who knows? Maybe that is something on the innovation side because the weight of the evidence may not be as great as a different strategy. So there's also that piece in there for innovation. Okay, so you all did a very nice job with how will you know you reached your aim. So why don't we talk about some of the folks who put some measures in here. I'm going to say, Elizabeth, do you want to come off the line and talk about some measures for how you will know you reached your aim?
Sure. I was going to say, I don't know, I didn't really go too far into the aim, but I think just knowing obviously where your baseline is, and then defining, is it like a monthly, a weekly, or whatever, and then what you want that number to be, and then I guess they didn't come up with a specific one, just making sure that you are tracking it and having like a regular check-in with the data.
Yes, right. And you may check in weekly, daily, monthly. You decide what you can do in terms of data collection. So I'm going to take, have everybody in person, it wouldn't seem so awkward, but I want everyone to take a couple minutes. And so we're going to deal with the awkward silence on the virtual platform. But go ahead and try to write a 90-day aim statement and put some in the chat there. And then we'll have some people read them out for the social piece. By May 2022, I will be healthier socially. So go ahead and try to be really smart in how you write that and type that into the chat, if you will. can hear you all thinking. Okay, I tried to combine some of what are the ideas that you were all putting in there. I'll give it a few more minutes to type in an aim statement, and then we're going to take one of them and go ahead and create a PDSA. You'll see the one I put in there by August 2021. I will be healthier socially by meeting a friend for dinner once a month, going for a walk with a friend once a week, and having a phone conversation with a family member for at least 10 minutes once every 2 weeks. What I want to point out here is that oftentimes we have a larger aim statement with a child safety aim, like Maria had put up with the motor vehicle traffic safety and reducing deaths or hospitalizations related to motor vehicle crashes. But then underneath that, you get really specific with some of these different strategies or goals. So seatbelt use would be one. Maybe education is another one. We have Rachel who's chimed in here. Rachel, do you want to come off the line and read your aim statement?
Sure. Can you hear me?
I can.
Great. I've said by May 2022, I will be healthier socially because I'll be spending time with friends or colleagues once a week walking. I'll know that I've achieved this because I'll have strong connections with at least 5 people, and I will have lost 5 pounds because of walking.
You put a physical goal in there, too. You snuck it right in there. Good for you. Fantastic. Okay, does anyone else want to go ahead and pop an aim statement in there? If not, we're going to take Rachel's aim statement, and we're going to ask you to create a PDSA that will motivate you even further to work toward this 90-day aim statement. Okay, I think we are going with Rachel's aim statement, and we're going to work on a PDSA. So here's just a reminder. This is the slide that Jenny went through. And over in the plan section, that's where you start first. That's step 1. And you start with a question. What do you want to learn? And then you say, okay, what do I predict is going to happen? And then you put down your plan, and then you put down some measures. So looking at Rachel's aim statement, what would she want to learn from this? And I can give you a little more information. I know that's really out there if you haven't worked on these things. Let's take the first part of her aim statement. I will be healthier socially because I will be spending time with friends or colleagues once a week walking. Now, Rachel, I don't know if you live in a mountainous region. I don't know if you live in a rainy season region. But there may be something you want to learn about whether you can do this once a week walking with your colleagues. And you had could have questions like, is walking on the weekend more achievable than walking during the week? Or is walking at a certain time of day going to work better? Or is driving somewhere that's more scenic going to encourage you and your friend to get out there? So you would have some question that you would want to be putting into the PDSA that would really focus your PDSA? Jenny has one that's a little bit broader. Will spending regular time with friends improve my social well-being? Mm-hmm. Jeannie and Rachel maybe typing in a little bit there. Is walking indoors or outdoors more realistic for me to do it regularly? Oh, that's really interesting. Okay. How many times will my friends be available to walk? Jeannie's asking. Great. Okay, so let's go ahead and work on a PDSA. Let's take, and I think that Jeannie's fits into Rachel's really nicely there as well. So let's take this question of, is walking indoors or outdoors more realistic for me to do it regularly? So what do we predict is going to happen? Do you have a prediction, Rachel?
Yes, I live in Missouri, which means I can only walk in about 3 seasons of the year. So sometimes I will have to probably walk indoors at work, and other times I'll be able to walk outdoors with friends.
And when you walk indoors at work, are you alone or with friends?
I'd say work friends. We could walk together indoors.
Okay, and I think that's an important piece because you're staying true to that aim of the social connection piece, right? So you're doing an activity with somebody else. Okay, so it's 90 days, and you know, we would think that over the 90 days there may be circumstances where you wouldn't be able to walk outdoors. And so this could be a really good test to see, you know, if it's too rainy or inclement weather or whatever it is that would push you to working indoors versus outdoors. So you may have some predictions around that. You may think that in the month of June you can walk, you know, outdoors, but maybe, I don't know, maybe in August it's too hot, or that you'd be more indoors. Or maybe your schedule changes and you have to go to work, you have to work longer hours in one of those months. And so your day became longer and you're too tired to get up that early or to throw something in at the end of the workday, so the indoor piece is going to be more likely for you. So you want to start thinking through some of your predictions. And Jeannie has a really good one there. How many times will my friends be available to walk? So it's a good measure. So now let's think about a plan. So what is your plan going to be? You want to walk. It can be indoors or outdoors. You think it's going to vary depending on the season. And how are you going to test this out? What is your plan going to be to get some people and go walking with them? What would you do? What would you do by next week if you had to set this up? And anybody can answer this question. Anybody can hop in and give thoughts.
Hey, Jennifer, this is Jenny. So
Jenny?
I love walking. This is such a cool example. So I think if I was setting this up initially, I think that I would start with a test where I would reach out to a friend and say, hey, you know, do you want to go walking on Monday? And then schedule for a couple of Mondays and see if we can meet at the same time, same place, and go walking and test that for a couple of weeks to see if that pattern might work. And if I was thinking of walking with different friends, maybe I would set up 2 walking dates with 2 different people and see if, you know, we set a schedule and that expectation, what happens. And of course I expect that I'm going to run into some scenarios where they're going to tell me that they had a sick kid or some other kind of appointment or something came up, and we'll have to adjust or skip our scheduled time. And so then tracking that would help me to develop a better plan about how can I mitigate some of those expected interruptions and still establish a regular routine of getting together and walking with my friend.
That's great, Jenny. And you may also text a group of people so that if one or two people can't make it, you still have somebody else. You're still hitting that social interaction piece. And maybe you're texting some work friends and also some friends who are outside of work. So then you would have your measures in place, as Jenny just described. You know, did you go walking? what was the weather on that day. You would want to track that because you were concerned about the indoor and outdoor. And then you would go ahead and you would do that. And then you would, you're in the do phase now, you do it, and then you describe, well, what happened? Were there any surprises that occurred? Were there any obstacles that I faced? Maybe you started walking around indoors and you were told you couldn't walk in a certain area. Or you couldn't walk in, you had to do it at a different time or a different room or do different types of exercise. And then you would study what happened. You would say, okay, so I planned it out and I had my prediction, and then I learned what actually took place, and maybe it went really well. And in that case, I can act on doing things exactly the same. I'm going to adopt what I'm doing. This worked beautifully. Or maybe what happened in the do phase versus the prediction or your study phase, maybe things didn't go so well, and you need to make some adaptations. Maybe there is one person who just never shows up, and that person, you're like, it just doesn't seem like it's going to work out. Maybe I need to invite more people. Or maybe the time of day doesn't work for everyone, and so you're going to try a different time of day or a different day altogether. And then the third thing there in the act is maybe you have to abandon it. Maybe for some reason something happened. Maybe you got injured and you can't walk, and so you have to abandon this idea and you have to come up with something else and some different way of being socially interacting with your friends. I'm going to pause and ask if anyone has questions on this cycle and this process of moving from your system, you have your big aim statement, your 90-day aim statement, and then a series of PDSAs that you can run.
I have just one more that I feel like it illustrates how PDSAs go in the office for me. And it would be just go walk where and when you want to walk and see if you happen to find any people there. Because I feel like that would be more illustrative of how some of our cycles where we've tried things and all the kind of like planning and figuring out stuff just seems to be elusive, but sometimes you just stumble over a solution. So maybe just try something totally new.
Yes, yes. And so another piece, a nugget, a QI nugget, is that you start with volunteers. So, you're testing out something in the office about how you're relaying some information or a flyer you just developed. You can just go to the two people who are sitting right next to you and say, hey, can you look at this for 5 minutes and tell me what you think? You're collecting real-time data. It's a quick cycle. You're going to get information, within a day or 2 days, and you act on that. And so the idea is, back on Jenny's chart, you can stumble upon it and you start to build the evidence. So if it kind of worked out and you got some new idea, then you say, okay, let me try that out. And let me try it with a few more people. Let me try it with even more people. Let me try it in a different office where the culture is different. And then once there was enough confidence that what you were doing is working, that helps to get people on board too. Because think about in traditional research where we have publications and a lot of recommendations. Just because it's written up and people read it doesn't mean it's going to happen in practice. You have the psychology behind it and the behavior change behind it where people need to buy in and adopt it. So sometimes what we say is start with the readily available volunteers who are eager to try something out and then build from there. That was a great comment. Thank you.
Jennifer, we also have a comment from Dina in the chat.
Okay, Dina. Thank you, Maria. Even if I'm able to walk with a friend once a week, PDSA could be a good process to go through if I'm walking less than what I want. For example, if we only walk for 30 minutes and I was to measure success as a 60-minute walk once a week. Yes, that's an excellent point, Dina. And so the PDSAs help you to document what is taking place, which gives you real-time data. Is this working or not working? Am I really achieving what I want to achieve? And I think that's great. And then maybe there's some learning there around, well, why not? Why am I only doing 30 minutes? Maybe Bina had set up in her mind that she could walk for 60 minutes in the morning before work, but then she found out that that's just way too tough. She needs that extra 30 minutes of sleep. And maybe she tries doing 30 minutes in the morning and 30 minutes at night instead. Great comment. Okay, any other last comments or questions? Okay, I'm going to hand this back over to Maria.
Great. Thank you so much, Jennifer. This was really great, and thank you for all of the interaction. I hope that this was a fruitful discussion for all of you and a good example of something timely for us as well. So if you have any questions or comments, you can continue to put them in the chat or unmute yourselves and let us know what you're thinking. I think that was a very informative exercise, and we got through a lot of different examples. So thank you all. I would love, you will see an evaluation popping up on your screen in a moment or so. But we do have a couple of things that I'd like to point out from CSN. So we do have our resources available today, and I was indicating that we had some worksheets, some fillable worksheets that you can work on your 90-day aims with your teams, your PDSAs, and a couple of the webinar links to our framework paper, our quality improvement framework paper, and everything else. We also have a couple of tidbits here about if you're not familiar with our work, we can help your state or jurisdiction. You can check out our website. We have a couple of our resources linked here. You can always request technical assistance. So if you're downloading some of our forms here and you need some help as you're working through them with your teams, please let us know. We would love to hear from you. Please keep in touch also about the Child Safety Learning Collaborative. We will be launching our applications for Cohort 3 this summer. And join our newsletter mailing list if you're not already on it. We would love to have you receive our materials, our resources, and all of the great research that we collect and distribute on our topics. So we would also invite you to visit CSN at upcoming conferences. We will be presenting at AmChip next week. We have two poster presentations there on using real-time surveillance data to mobilize adolescent suicide and self-harm prevention programs, and also on using the Health Equity Planner to inform state child and adolescent injury and violence prevention programming. We will also be at PrevCon in July. So we're presenting on the Children's Safety Network Fire and Burn Prevention Resource Guide and the Child Safety Learning Collaborative and Quality Improvement, Making Progress During Times of Disruption. So we do hope that you'll join us and interact with us there as well. So as I mentioned, the Child Safety Learning Collaborative will be launching applications for Cohort 3 in late June. They will be due in August. So if you're interested in working with us on the collaborative, please feel free to reach out to us for more information. Check out our website, and the applications and all of the information will be going out through our listservs. So please sign up for our newsletter mailing list. If you have any additional questions, please feel free to join us. And as you saw, the evaluation came out because we practice what we preach. At the Children's Safety Network, we are in a constant state of quality improvement ourselves. So we do hope that you'll provide us with some feedback about today's webinar, about our different format for today, our learning lab, and what you thought of it. And please give us some feedback. We'd love to hear from you. And we'd also love to hear what else you would like us to present on for future state technical assistance webinars. Oh, and thank you so much, Jeannie. That was a very nice comment from you about the resources that CSN provides. We do thank you all for participating. We thank Jenny and Jennifer for their great facilitation today. And thank you all for taking the time to meet with us. We really appreciate all of your interaction and sharing your thoughts with us. We hope you have a wonderful day. Please stay safe.
Bye. Thank you.
Bye.